Don't you hate it when a therapist comes at you with a glove on his hand? There are only a couple of things that can happen when they put a glove on, and one of them is not good. We're going to do the one that is good. We're going to work on a TMJ problem, and we're going to do a very, very simple protocol for it to help people who have jaw retrusion. Jaw retrusion is when the jaw wants to get crammed up into the mandibular condyles and create all sorts of tension and pressure on that little disc, meniscus in there that's supposed to move and help glide the joint open and closed. Common problem is that the head, in a forward head posture, the head wants to go forward, and the jaw, sometimes the hyoids, the suprahyoids, infrahyoids, through that digastric sling, they get caught and they go, no, we don't think so. We're going to hold the jaw here. And so it holds the jaw back in relationship to the head. So all of this, the zygomatic arch moves forward, everything starts to move forward, the jaw gets crammed up like that, and we see jaw retrusion. Start looking at people with forward head postures and notice how many of them have jaw retrusion, retruded jaws. So we're going to try to pull that thing out of there, pull that jaw forward and out. And there are a couple of ways to do it. Typically what I like to do is to come to the end of the therapy table and work on the outside musculature. I'm not going to spend a lot of time doing that, but you come in on either side, you start to loosen the superficial structures. I like to push down on the masseter, the big muscle that closes the jaw. Push it down. You're always thinking, pushing this stuff down out of the condyles. Decompressing it down and out of the condyles. So on the outside, you can do some of your warm-up work to calm the cutaneous and skin receptors, or you can do some holding work to calm down some of the more delicate articular receptors. Then, once you get that, you come in on the temporalis, which is another jaw closer. Loosen that temporalis, particularly if it's really tight. Then I'm going to ask Michelle to open her mouth pretty far, open it, and then come in and close it a little bit. Come on, close it a little bit more. And I'm going to come right under the zygomatic arch in here, close a tiny bit more, and I'm going to catch temporalis right here. This is a piece that we don't catch. That edge of the temporalis where it attaches right here. This is about the only angle you can do it, right under here, and it's tender. It is a tender booger. So get in there and just do some sustained holding, and she can tell you that's a little painful, isn't it?
It's a little painful, but it feels fine.
It's a little painful, but it feels fine, she says. Okay, so we do all of that superficial work. I like to also take my hands like this in a V and do a little mobilization here. Notice how I'm going this direction. Joints like that oscillatory motion, that oscillating motion, so I just get a nice rhythm going using my whole body weight, keeping my lumbar lordosis locked in, and I just mobilize this thing like that. Feels good, should feel good. No big deal here. Okay, now I'm going to come in here and go intraoral, and I'm only going to do one or two simple techniques. I'm going to come in first on this side and just do masseter. So here's what's going on over here. Just coming in. Notice how this internal finger is working a little bit, and I'm just going to soften the masseter a little bit. I'm not going to spend a lot of time on that. The lateral and medial pterygoids are two muscles that I'm not going to treat because they are hard to show anatomically. You have to get a camera in the mouth to really show them, or show through dissection. But I'm going to work on the masseter, and just know that the medial pterygoid and the lateral pterygoids both sometimes it's helpful to work those. But what I found the most success with doing this kind of work is this simple, very basic technique. Open your mouth. Here's what we want to do. First of all, you make sure that these are all their teeth. Say, are every one of these your teeth on the bottom, because you do put a little pressure on the teeth and the gums, and I've heard of people pulling plates out, which is not much fun. So look at this grip that I have on Michelle. My fingers are under like that, and my thumb comes in like this. My hand goes on her forehead, and here's the tricky part. I'm going to want to lift up, and at the same time I'm lifting like this. This is the motion.